Hello, my name is Dr. Frederick Covington, and I'm a pediatric occupational therapist. As an occupational therapist, I work with several diagnoses. One of these diagnoses that I am beginning to work with more and more is diabetes. According to research conducted by the National Institute of Health, since 1988, the prevalence of diagnosed diabetes within the United States has increased by a phenomenal 382%. Now, what is diabetes? Diabetes is a serious disease. It means that your blood glucose, also called blood sugar, is too high. Having too much glucose in your blood is not healthy. So let's discuss two types of diabetes. There's type 1 diabetes. Now with type 1 diabetes, your body cannot make insulin. You need insulin to use the food you eat for energy. With this type of diabetes, you need to get insulin from shots or a pump. Your genetic makeup and other factors may cause a person to get type 1 diabetes. Now there's type 2 diabetes as well. With type 2 diabetes, your body cannot use the insulin it makes. Teens are more likely to get type 2 diabetes if they weigh too much, if they are not active, or have a family member who has a history of diabetes. Now, for those individuals who are likely to develop diabetes, as well as those who already have the diagnosis, occupational therapy practitioners are able to play a vital role in diabetes education as well as self-management. A means to do this is for the OT to focus on 7 areas and behaviors advocated by the American Association of Diabetes Educators. These areas are healthy eating, being active, monitoring, taking medications, problem solving, healthy coping, and reducing risk. As an OT, I assist my clients in developing simple, measurable, and concrete and achievable self-management goals consistent with these 7 behaviors. Some concrete examples that I have utilized with families include promoting and teaching healthy food choices and safe cooking methods, or establishing and instructing in safe and appropriate ways to incorporate physical activity and exercise into daily routines. Also, providing techniques to organize and track medication. And also for those clients with peripheral sensory loss, which can be described as a numbness or a lack of feeling in the hands or feet, for activities that involve exposure to heat, cold, sharp objects, or anything that's potentially harmful, I incorporate protective techniques and compensatory methods to increase their overall safety. Now, this is just a few of the ways I directly work with clients and families dealing with diabetes. Now, all of these methods are delivered on an individualized basis. Reason being, what one client or family may have access to, other families may not. So as an occupational therapist, I adjust to the family's economic means, their family makeup, living arrangements, access to grocery stores in their community, transportation, and any other thing that makes that client an individual. Doing this instead of having a standard cookie cutter approach to approach diabetes or to address diabetes is the ultimate key to success. So again, my name is Dr. Frederick Covington, occupational therapist. Thank you for joining me, and we'll be seeing you next time. Take care.